there's a restriction to the number of people who attend funerals, and we really want to underline the importance of keeping to a low number of people attending the funeral, because there are various things that are associated with funerals which we may tend to create a challenge that might expose people to contracting COVID-19. This is important for us to say. Social distancing still remains a very important issue to curb this pandemic. Unfortunately, we've also observed that quite often during funerals, as people are giving each other comfort, then they will be hugging, they will be holding each other very closely, and some are crying, maybe some are coughing, and so on. These are some of the things that come naturally to us, but we just need to make our people aware that this is a matter of concern to us. We also see that when people are, covering the grave, they would then be exchanging the spades, and when they dig, they exchange the picks and then the shovels. And this also, we think that might be a challenge, particularly if people have got their hands which are not protected with gloves. Sometimes when they come back from the gravesite, then they would be washing hands on one basin, and sometimes they also have to go through a buffet of a meal, which means it's 1 spoon per person, 1 spoon for everyone, and therefore we don't have a spoon per person. So we think that some of these issues are a real challenge. So we would like to ask our people now to change the approach as they deal with the issues of funeral. When we talk about the case in South Korea, one of the issues that we keep looking at is how an open buffet has actually been a factor in someone walking around touching the spoon and everyone else using the same spoon. So these are some of the things that we must now start thinking about. This is now a new reality that we have to be aware that you may not know if someone has got the infection, and therefore we need to now understand that there are changes in the way we normally do things that we must start looking at. And when we were discussing, we had a meeting earlier this morning and with all the provincial leaders, and one of the issues they were raising, particularly those who were raising the factors in the area of the Eastern Cape, they pointed out at the issue of the correctional services, and on the other side, they raised the issue of movement of people coming to funerals. And it looks like attending the funerals still has a huge challenge that might be creating, centers where the infection can spread. And so we need to alert our people that there is a challenge in this particular area. So we also just need to indicate that we have been doing quite a lot of testing. If we look at the numbers that we have reflected, we reflect that we have done 108,000 tests. And these tests, for us, we still want to increase the numbers of testing so that the numbers of people who are ultimately tested is actually quite high. However, since we have since we had announced that we're going to be doing community screening and increasing the tests, the numbers have actually been showing quite a lot of increase. So today, the number we're reporting on was 108,021 tests. Now, this is the number of patients, of people tested. But the number of tests actually is much more than that. The total number of tests which have been done is 123,000. And the distinction we make is that sometimes it takes more than one test to confirm a diagnosis. Sometimes people get the test done several times during their period of treatment. In some instances, we have to actually, most of the time, we have to actually test someone before we release them as completely recovered. So that number will always be higher. So there's a difference between the number of tests that have been done and the number of people who have been tested. And when we report, we always report about the number of people who have been tested, not the number of tests done, because there are people that we know, for example, who would have had 2 or 3 tests done before they even confirmed the diagnosis for the first time. So this is the issue that I think is important to clarify. But over the past few weeks, we have been increasing the numbers of people who are being tested. And I can also just indicate that when we started, about 99% of the tests had been done in the private sector because of the nature of the, in the first few cases that we had were people who were travelers who had been all over touring various countries, and they actually have access to medical aids and so on. So a large number of tests were done in the private sector. And later on, the numbers that were coming from public sector was very minimal. At that point, of course, people who were in the public health services did not have as much of exposure to the infection. So, but as time went on, now that we have been out there, talking to communities and screening them and so on, we have actually increased the numbers to the extent now that we've got the figures that we're showing. About 2 weeks ago, I would say that in the public sector, we could have probably been testing up to about 1,000 or so tests per day. But as the time has been moving on and the community screening was raising its momentum, we've come to a point where, like the past few days, the numbers that were tested started being more than 5,000 on the public sector, per day rather, and then the following day. So today, for example, on the last 24 hours, we've actually performed over 7,000 tests, 194, which basically shows that the momentum is actually growing pretty well. And this is because of the strategy of increasing to massively test our people. It cannot be expected that you can get all those thousands immediately, but you have to keep pushing the number up, because we have to now move people to go into mobile teams that go into various communities, as it were, to reach out to many communities. If you look at the world worldometer, the coronavirus worldometer, you will notice that there are not many countries which have got up to 2,000 to 3,000 people who are testing positive, that have tested as many as we have. I think there's only one country that's closer to us, is Thailand, which has got almost 100,000 people tested as well. But nevertheless, if you also compare some of the countries, even in the Europe, in the epicenter, you will still find that there are countries that are at 50,000, at 70,000, and so on. So obviously, the conditions in various countries are not the same. In our case, we still want to increase the testing to test many more people. When we went to analyze, we found that, for example, America has tested a couple of millions of people. When you do the estimation there, the analysis, they are able to say for every 5 people that they've tested, then 1 is positive. In our case, it's still quite, our infection level is still not as high as all of that, but because we are pushing the numbers to make sure we reach as many people as possible, and we also have to tighten up on the criteria to, increase the diagnosis. So we will find that for every one person that tests positive, we would have done 38 tests. So that basically gives you the variance between the different countries. But for us, it's important to say that the numbers, I'm satisfied with the level of growth of the numbers, but I don't think we're anywhere close to where we want to be for purposes of increasing the numbers. The level which we need to reach out to is still quite high. So from our point of view, we believe that many more people still need to be tested And that is where we're going to be going. So every week you will see that the numbers will keep continuing to increase, as it were. But it also means that we will find more people who are turning positive because of the fact that we are going all out to fetch people in the community who would have not presented themselves to come to the government hospitals. So there's a big difference between the numbers, the kind of people that we are bringing in as opposed to what was happening before, because people used to go and seek assistance. But in this case, we're actually going all out to get them, to be referred to the hospital. So we have recorded at this point close to 900,000 people who have been tested, who have been screened, and out of those, we've got probably about 11,000 people who have been referred for testing. This is just in the past couple of days. So I think that is something that we're doing fairly well, in terms of testing, but we have to keep pushing the numbers. The other issue that I think is important to clarify, we did yesterday, a couple of days ago, we announced the numbers of recoveries as 903 people who have recovered. Now, the recoveries, even though you will have people who are recovered, we do not reduce the total number of people who are positive simply because there are others who are now recovered. What we normally would do is to classify them in different ways. So the total is the numbers of people who have tested positive ever in any country. And then secondly would become what we call resolved cases. Resolved cases then are those who are recovered together with those who would have passed. Those two together give you cases which are closed. In other words, they are no longer part of the health system. They tend to be now people who are, their issue is no longer within the health system. So the remainder, we call them active cases. So the active cases would be around 1,600, depending on what the total that we're working on for that particular day. So this is how it is classified throughout the whole world as a way of making sure that we all have a standardized way of calculating. So because the numbers of people who recover, we tend to hold them on for so many weeks before we can proclaim them to be recovered. That's why you would have seen that for a long time we did not report anyone as having recovered, and then there was one, there were two, and then there was a bit of a lull and so on. But as the numbers increase, the people tend to come in kind of batches within a particular period, and that's why the numbers will come out, with a huge number. But we normally, where I sit every day, I receive daily reports from all the MECs about the numbers of patients who are admitted in hospital, numbers of patients who are in ICU, the numbers of patients who are they improving, are they not improving, and so on. This is right across, whether it's public or private. There tends to be a report that comes to the provincial government, and that that happens just because we have to work together as the health services. If I can just hold it at that for now, maybe we can just take some of the questions, and then we will try and bring the matter to a close.
Thank you, Minister. We have a question from Ntakwane Ngatane from EWN. The question is, Lesotho nationals on chronic medication who are unable to go home due to the lockdown, some are HIV positive. They say they're unable to get ARVs in South Africa because of the different regimens in the two countries. Have the two countries talked about how they can be helped and what has been agreed?
Okay. Yes, that matter has been brought to our attention. So our officials are attending to the matter. Obviously, what we have to decide is we need to work out whether we're dealing with people who are coming into private hospitals or coming into public hospitals. But at the end of the day, some of these essential medication are things that we need to work together and assist each other. When there's a need for someone to come for medical attention, we actually get to give them exemptions. So it happens every now and again that if someone needs to be given attention, assistance to get into South Africa, that we will assist them and clear that. There have been other cases where people had to come for emergency operations, and I recall a few weeks ago with a child who had to come from Zimbabwe. So those we actually have to make special arrangement. So we'll keep, assisting where we can. As long as we get given the information, we'll then follow the matter up and try and get it resolved.
There's a question from Kyle Cohen, News 24. Minister, how many people have been screened so far in the community testing and screening program? And how many of those people have been referred for testing as a result of the screening program? What proportion of those referred have been found to be COVID-19 positive?
Okay, the number of people who have been screened is close to 900,000, and about 11,000 or so, between 10 and 11,000 have been referred for testing. Now, we can only classify the percentage in totality. So when you look at the positive cases, you don't calculate them on the basis of those who are referred. You calculate it on the basis of the total number of people who have been tested. And in South Africa, the average we're at, it ranges between, let me say, 3.7 to close to 5. The provinces vary. So you would find, for example, out of those who have been tested, maybe about 5% would be in KwaZulu-Natal, Gauteng, 4.7 and thereabout. But some of the provinces are at 0 point something. If you were to look at the proportion of people who turned positive in that province versus the total that would have been tested. So as an average, I think we're close to about 3.8 or so as a country. It's just an estimation that I can give, but we don't calculate it on the basis of each batch as people get referred, because when they get to be tested, they'll come and be tested and we get the results together for the whole country. We don't get for a particular area, but we also don't just look at the public only. We also look both at public and private and look at take them as a totality.
Thank you, Minister. The next question is, considering what happened at Netcare St. Augustine's Hospital, do you have an update for us? Are there any such outbreaks at public hospitals that you are aware of?
Well, we have not been notified of any public hospital that have got such outbreaks. We are trying to compile the list of all health workers who could have been found to be COVID-19 positive. In that regard, there would be some that would have been in the public hospitals. I don't have exact figure right now, but we were concerned with what happened in St. Augustine's because the number of staff who were found to be positive was just too high. In fact, it was actually quite a shocking one because we didn't expect that you could find, up to 48 and more people could be found in one institution, one facility. So certainly this is an area that a lot of work is being done to make sure we get to the bottom of what happened, but also to make sure we prevent this from happening in any other area. So at the moment, we don't have a similar number of people who would have been involved in a kind of outbreak in the public hospitals. We were concerned as well that in some instances, some of the people who were found in some of the public hospitals were actually moonlighting in the private hospitals, but we don't have a thorough analysis. We're just dealing with preliminary observations.
Thank you, Minister. The next question is from ENCA. Can we please ask, last week, the advisory committee said that by this weekend, it would have a clearer understanding of the true average daily local transmission. What is the average daily rate of local transmissions currently?
The Ministerial Advisory Committee is still doing its analysis. I think at a certain point we'll probably open that up and discuss it publicly. The indications are that the figure that they were looking at work on the basis of a kind of statistical range, which means from this figure to that figure. And then in this case, they were talking about 45 to about 89. And as they were analyzing the figures that were coming in, they were of the view that the figures, I think the past few days, they were looking at the figure which was about 90 or 95, depending on the day. And when they looked at them, they felt that these figures were still within the broad range of, if you look at the figure of 45 to 89, the difference between that and the figure of 50 to above 100 is a statistical issue where they feel that the difference is not too wide at that level. So what they were then going to be looking at is the percentage change in the new tests that are being analyzed, taking into account that you are no longer dealing with exactly the same cohort, or maybe not the same type of patients that you're analyzing. Was the first patients that we're analyzing went themselves out to go and present themselves to the health facilities. But once you bring in an element of going to go and look for people out there, then it changes things a little bit. And in that way, therefore, they felt that there is not a huge indication of a huge change at that point. So we will still be looking at the next few days to see how the increasing numbers that we are testing are going to impact on the process. So where we are, we're at a point where the observation that they've given so far is that there wasn't much of a change in terms of the figures that they had from last week to this week.
Thank you, Minister. The next question is, can we systematically document treatment protocols for all the patients that have recovered? An analysis would tell us what worked and, if possible, what did not, so we learn from it. Another question, CHW's community health workers are faced with challenges during home visits. Some of the animosity may stem from the prolonged lack of basic services, real or perceived. What can be done to ensure that we remove the politicizing of an otherwise great approach to containing the epidemic?
All the patients who receive treatment are actually treated by medical practitioners, clinicians, specialists who have got a good understanding of the records that are needed to be kept about those particular patients. And in some instances, those patients get presented to bigger groups of other clinicians to be able to share the lessons from those. So for everyone, physician who's managing patients, they've actually got a team that they generally relate to. In some instances, we've actually had we have had a situation where there have been discussions with people who have come from other countries, such as Spain, such as China. So that basically gives us, continuous lessons as we move along, as we talk to various doctors who tend to be able to share the experiences. So it's, I would say, part of the way that we manage health services, that there will be, discussions, presentation of those particular patients. In the future, we're also hoping that we'll be able to have Zoom communication like this one, links where we'll have some of these patients presented, just to make sure that some of the doctors who may not have started treating patients can actually learn from those who would have already started doing so. The community health workers, we have not had too many instances where there are complaints of community health workers facing challenges. However, we do think that where it has been reported, it might well be related to a kind of anxiety that people have, and sometimes the kind of worry about stigma that they might be labeled as having COVID-19, and therefore some of the people respond differently, and they would say to community health workers, don't come in and so on. But it has not been widespread. Most of the people have actually responded, as our numbers are indicating. Close to 900,000 people means that most of the people have been very receptive to our community health workers. The question of lack of services, I think, is a challenge that we have acknowledged, but also it's not so much lack more than it is about the challenges of inadequacies in other areas, and in overcrowding, long queues, and so on. But when those kinds of things happen, that does not mean we cannot respond to and deal with a crisis of this nature, which is the issue of challenges of people wanting to always raise concern that they have not been properly attended to in this area and the other area. I'm not too sure about politicizing it, because since we started this whole discussion on COVID-19, we found that all political parties have worked together, they've been supportive, and this issue has been really elevated to be a national issue. It would be a pity if anybody would try and politicize it.
Thank you, Minister. Can you just clarify, you have now announced that there are 2 more deaths. What is the total number?
Oh, yes. I think when I started, I gave a number, and we have two additional deaths, which means that on top of the 50, we actually have 52. I'm very sorry about that, because the numbers of deaths that are new is only 2. That is on top of the 50 that has already been reported. I'm sorry about that. Thanks for raising it again.
Thank you, Minister. A question from Ntuache Seleka from News 24. Does smoking also have negative impact on the health of people who have tested positive? This is after cigarette sales have been banned in the country for now.
Well, actually, cigarettes have got a very negative impact on anybody's health. We always talk about the active smoking, and we also talk about passive smoking, and it induces so many other conditions which are related to pulmonary disease, pulmonary symptoms or chest-related symptoms. So the problem with smoking is that it tends to affect the lining where people, when people breathe, and it creates some reactions. In some instances, it can provoke a reaction where someone's lining is so irritated that it's easy to get an infection. They can easily get bronchitis. It's easy also to get other infections, or even tuberculosis. So it tends to predispose to those. But beyond that, it also affects the cardiovascular system. It creates, the nicotine effect is that it creates what we call vasoconstriction, which reduces the flow of blood to the small blood vessels in the limbs and in the body, and even in the heart. As a result, you might find that it actually encourages even the issues of what we call atherosclerosis, where you get lumps built inside the blood vessel, out of which you can have small clots that get formed. So all in all, it's really something that we discourage. Now, once you've got COVID-19 as an added infection, we believe that those who smoke are more vulnerable to being affected, because of the fact that COVID-19 does affect the capacity of the lung to be able to process the normal day-to-day exchange of gases in the lung. So we would really discourage people from smoking. I still have to find a good beneficial action that the tobacco will have in an individual. I haven't actually ever heard of it. So in general terms, we would really discourage people from smoking. I think more so with this COVID-19 is one of those that I think will be adding unnecessary burden to the person's body.
Thank you, Minister. And just as a follow-up to that question, what are your fears about alcohol consumption during this lockdown?
Oh, yeah. Look, the problem of alcohol consumption here is that we have to rely on people's sober judgments to be able to conduct themselves in a way that can encourage distancing, that can encourage people coughing properly, and the cough etiquette and hygiene and so on. The impact of alcohol is that it would tend to reduce that capacity in any individual. So we believe that it's not something that really is helpful in the management of COVID-19 outbreak. But of course, if you were to go to any of the hospitals, the less alcohol you have, the less trauma you will find in the hospitals. There will be less people who have been shot. There are less people who have been in car accidents. Fewer people who have been stabbed and so on. So I think less alcohol improves the health of individuals. That's quite apart from the impact of alcohol in the body. Everyone would know that alcohol results in a whole lot of other problems, liver problems, neuropathy problems, damage to the nerves. It messes up with the walking, the gait, and everything, and it's got lots of neurological side effects, as it were. So again, it's known, and so for me, I think that under the circumstances that we're working on, we really need everyone to be able to cooperate, so we can reduce the pressure in the hospitals. We can also reduce, the possibility of people getting infected, because everyone is taking a very responsible approach when they are on their own sober senses.
Thank you, Minister. A question from Catherine Child. How far are the preparations to isolate people who test positive, don't need hospital care, but can't self-isolate in a crowded house or shack?
We have, at this point, I think, identified countrywide close to 8,000 beds wherein a number of people could be moved to assist them to ensure that they can be quarantined for purposes of being away from their families whilst we're waiting for the incubation period of 14 days. So as much as possible, we would like to see that these beds are available at each and every district, so that people can be isolated in areas, can be quarantined in areas not so far from them. We also are increasing the number of what we call field beds, wherein someone who's on treatment does not need is not capable of being isolated at home and treated at home, will need to stay in another facility for the duration of the symptoms or the duration of the time at which they're still infective. This happens because what you normally have is that if someone has got no symptoms, but it might take them up to 14 days to clear the virus and therefore not be infectious to the next person. But if someone was getting better, feeling that they don't need to be admitted in hospital, but the circumstances were such that they will go back to a home environment where there are many other people in that area. Now we need to keep them longer, even though they did not need to be kept in the hospital, simply because we have to protect the family. So the isolation of someone who's positive continues in the hospital, even if they are not necessarily improved. And the doctor has to make a call. If they think that the environment is such that the individual will need to be to continue to be observed, but in the family, this circumstances is not possible, then that person would need to be put into one of those field hospitals or some of the hospital beds. Right now, we don't have any lot of pressure because most of the beds that we've got are not really highly occupied. But with time, when we increase field beds, it will also be to cater for those situations.
A question from Kanita Hunter. Can ministers say which province has most facilities? Also, is the minister concerned about patients with comorbidities who contract COVID-19 in hospitals and die as a result?
I wouldn't be able to say which province has got more facilities, but we have actually said all the hospitals, all the provinces must open up as many beds as is possible. At the moment, I think a lot of work has been done in Gauteng, in Western Cape, and in KwaZulu-Natal, and in the Free State in opening up additional beds. And this is an ongoing issue because I'm aware that they've identified new areas where they'll be putting up additional beds, and the plans are afoot. And in some instances, we may even be looking at setting up new hospitals or hospital structures based on the alternative kind of building material to make room for more space. So I think the area where we'll find more beds might be in use will probably be Gauteng, Western Cape. Already some of these are up and running. You might have seen that work has been done in the area of Nasrec and in Tygerberg. The hospital is already set up outside there. In KwaZulu-Natal, they've set up a few, but I'm aware that they're actually looking at the Durban Expo Center to put some more beds in that area. They've identified a few other areas. I won't name all of them because some of them they're still going through various contractual arrangements. But I'm satisfied that there's enough understanding of the fact that the numbers of beds have to be increased, and we'll keep pushing to make sure that the numbers of beds are provided ahead of the need so that we don't get swamped. The question of comorbidities, it is an issue of concern, and this is what we normally would call nosocomial infection, which basically means you get infected by an infection that you didn't have, but you got it since you were in hospital. This is always a matter of concern all the time. And part of our infection control processes are more about ensuring that we limit the amount of nosocomial infections whereby people must not go into hospital when they've got a different infection or a different condition. They end up getting their situation complicated as such. It does happen, but in this case, it's one of the things that when we talk about ensuring that our staff is well protected and that they are well trained, is to actually limit to the minimum any such possibility.
Thank you, Minister. There is a question from Vinicius Assis, who is in Brazil. The question is, South Africa has economic and human challenges as the whole world currently. How is government making its decisions? Is government working together in this regard? Before you respond, Minister, another question is from Adrian Basson, and it says, Minister, we are receiving disturbing reports of an unfolding food crisis in South Africa because of the lockdown. How do you balance these two health crises, the spread of the virus versus widespread starvation?
Okay. The question from Vinicius, true, South Africa is facing a number of challenges, health challenges, economic challenges, but at the back of what government considers, at the back of decision-making by government, are a whole lot of experts who are linked to this particular area. So there are economic experts, economic planners, economic analysts, health experts as well, that are at the back of this. So we get all of them to make their various scenario analysis, their forecasting, and then they come back to give us a sense. So, for example, as we sit here during the last few days, we were having the Ministerial Advisory Committee making a presentation through Professor Abdul Karim, which was talking about the epidemiology of the disease, the forecasting, and the all sorts of possibilities of what may happen to during this infection. On the other hand, we've got economic analysts who are actually advising various ministers and the president on the prospects of our economic recovery path. So they've given us a whole lot of information about what's happening worldwide, what is the likely impact of the economic downturn in the whole world as a result of the COVID-19, what it's likely to do in South Africa. They put up various scenarios, and all of those scenarios have to be put together with a view to say, how do we balance the two so that at the end of the day we limit the transmission, but we also help our economy to continue to perform. So we have a whole lot of analysts who are specialists and experts who advise us. But at the end of the day, government works together, and I think you'd be aware that the president is leading the whole team. We've now converted and created what we call the National Coronavirus Command Council, which effectively looks at day-to-day responses on the various aspects of what needs to be attended to deal with this epidemic. The issue that's being raised by Adrian Basson is a matter that every day when the National Coronavirus Command Council meets, every day this matter gets discussed. What is the best way of ensuring that there's a balance between limiting transmission and also ensuring that we protect the income and protect the food supply to our people? There's a huge amount of debate that goes on a continuous basis. We are all concerned that whilst what we need to contain the virus is to reduce the movement of people, to reduce the large gatherings and so on, we're very conscious of the extent to which all of these have got a negative impact on the economy and on the food security. So we are involved in this discussion on an ongoing basis, and whatever steps you will hear when the next few days, as has been the past few weeks, you will know that they've taken the two issues into account. What is best for the economy, what is best for food security, what is best also for containing the viral infection. So it's a balance that's going to be always very tricky. But at the end of the day, the decisions government will take are in the best interest of our people. So there'll have to be interventions that will assist our people not to suffer from hunger and starvation, but also to limit the spread of the infection. It's a very tricky balance to maintain because our economy was in any case already under pressure before the COVID-19 outbreak. So it's an issue that is a challenge to us. When we had to close the borders, we knew that there are people who are going to have a challenge because they are employed in the hospitality industry, in the tourism industry, and in the transport industry, and all of that. And all of those people are without income, and we're very conscious and very sensitive about that. But at the end of the day, we need to keep a balance of what is it that we can do so that we can continue to survive, at the same time limit the infection, the transmission. So we are aware of some of the concerns that are coming through. And every day, part of the reason why, for example, we have meetings until so late is to look into all those possible options of what can be done to save our people, both from hunger as well as from the infection. It's not an option of either or. There's no way we can say to our people, we can lock down in a way that is insensitive, such that people end up suffering from hunger, because what should they do? I mean, you can't expect anyone to do anything else if if they are actually starving. So the balance between the two is going to be a very tricky one as we move forward. But we are actually very conscious of the concern, and I think you're raising it now. We've also picked it up as well that there are areas where even the availability of food, even the food outlets, even the delivery of food, all of these issues. There's been a whole debate now about whether the issue of food parcel, is it adequate? Is it the best way? Are there other options that we should be working on? So even today, the president was discussing the same issues with the premiers, with various MECs. So I think your point is really quite relevant. It's just that, as time comes along, we're going to have to look at how to balance all of that together.
Thank you, Minister. A question from Andrew Meldrum of Associated Press. What are the factors that will determine whether or not to extend the lockdown beyond April? Is a partial easing of lockdown being considered?
Well, I think it would not be correct for me to start making speculations. I think the president has announced what will happen for the next 2 weeks. And so we're working within that space. And in between, all sorts of issues have to be taken into account. And I can just say there isn't one factor that you can say there's only one factor to consider. But I think broadly what brought us here was how do we manage to reduce the rate of spread? How do we contain the virus? And so that factor will always be amongst the factors that we have to take into account. How do we make sure that our economy continues to function? How do we make sure that we reduce hunger, starvation? How do we make sure that we can create a whole new culture of people behaving in such a way that the prevention of the infection becomes a sustainable kind of conduct in the way we look at, we behave ourselves in terms of all the issues of prevention, the issues of how we socialize. So it's a whole combination of issues that we have to take into account, and there isn't one factor that is more important than the others. But at the end of the day, it has to be that we must be able to contain the virus and still make sure that our people are able to survive in an economy that will be able to make all of us to be able to have our income and have our food security and live a kind of life that is sustainable. So it's going to be a balance of a number of factors. I don't think one can put one factor, and I also don't think we can say that we can already predict what must happen afterwards. I think part of what all these assessments that are being done will actually empower us, and as time goes on, we'll have a better sense as to what's happening. Maybe as the weeks go by next week, there will be a lot more information, and therefore we might be able to make announcements. Fortunately, what has been good in this whole situation is that whenever that decision is taken, president comes out and makes the statements very clear ahead of time. And also, if there are issues that we have to deal with from the health and other departments' point of view, we all go out and try and clarify it so that our people always know where we are, what's happening, because there's no one person with wisdom here. We always pick up what comes from our community, what comes from various other experts and analysts, and we learn from other countries, and we try and combine everything.
Thank you, Minister. A question from Murray Williams, News 24. When will various economic scenarios be presented in the same manner as the medical scenarios have been shown?
Well, I can just say to you that ever since we've been dealing with this COVID-19, there's always been discussion on the various economic scenarios with various possible forecasts that are being looked at, and it's a continuous process. We do not have one particular time where we say we only deal with this issue at this point. But at this, in terms of when will that come to the fore and be in public, I'm not sure. I'm not aware that such a thing is on the cards. But I think it shouldn't worry us so much that what I think should be of interest is as soon as a decision has been made based on whatever options and whatever choices, that such a decision will be public. And then, of course, you can ask all the questions, and those who will be announcing the decision will be in a position to tell you what factors have been considered and so on. The economic analysis and the focus are really planning tools. They are not so much that they are absolute. They are about giving you a way to think, so that as you take policy decisions, you take it on the basis that you make certain choices, and whatever the analysis or the focus was, it may not necessarily be obvious on the decision that you take, except that all those factors would have been taken together, and it will give us a way forward that is going to balance various issues, because it's not just economic analysis, it's also social other issues that are part of it. It's a whole lot of other issues, such as health considerations, educational issues, and crime prevention issues. It's a whole lot of issues that get to be part of the equation.
Thank you, Minister. Can you also clarify which province has the highest number of fatalities?
At the moment, KwaZulu-Natal has had the highest number, 21, which has also been a matter of very serious concern to us, because a large number of those actually happened in one hospital. Then, of course, the next hospital is the Western Cape with 16. Again, we always feel very certain when we lose any of the patients. And so those are the kinds of numbers that we've got. And we are always now on the lookout to just check if there are any individuals that could be lost before diagnosis. We have actually picked up in some instances where we take a test, and then the patient passes, and then of course we find out afterwards when the test comes, and it confirms that they are positive. So we're on the lookout for where there could be deaths associated with COVID-19. But the figures are KwaZulu-Natal has got the highest, followed by Western Cape.
Thank you, Minister. A question from Begim Pila. Minister, we are not seeing significant growth in the number of tested individuals. What are the plans of improving this number? The second question, what is the impact on South Africa with regards to the pronouncement by the US to halt its funding to the WHO?
Well, I think we need to be supportive to our health workers. They are doing their very best, and they have tested more people than we have seen in other countries. We have said that we need to increase this number, to much more than what it is now, and we will do so. But I think it's important to appreciate that there has been so much work done to actually get us to 108,000 tests to be done, individuals to be tested, because in the process, we have looked at various other countries. We realize that not everyone with the same number of positive cases has tested exactly the same number like what South Africa has. I gave an example earlier that the one country that is closer to us in terms of testing was Thailand. The other countries have actually had many more days of exposure to the infection, and therefore, and some of them, of course, are well-to-do countries. And so, but in our case, we actually want to ramp up the testing such that we must have a very significant number of people tested. It's in our interest to do so. And so the numbers of tests that we are now able to do, we've received additional kits, and so we should be able to test as many people as are referred through our screening process. I don't believe that we'll actually have a situation where there are so many people screened and tested and referred for testing that we are not able to test. So I think from that side, our capability is actually quite well established, but it's the process has to be accelerated. So we agree about increasing the numbers of people to be tested. The question of the pronouncement by the United States government is very unfortunate because as far as we would be concerned, WHO is a non-partisan body that looks out for the interest of all member states, and the way they manage this issue, we believe that they've actually handled it, reasonably well. And I think they may well obviously have whatever mistakes that they might be having, but they were quite quick to pronounce that the coronavirus is declared a public health emergency of international concern. If I'm not mistaken, at the time when that happened, they had 5 countries where they spotted transmission, human to what we call internal transmission. And then afterwards, when there were about 28 countries, then they declared it to be a pandemic, and they called upon all member states to do everything they can to prevent the spread of the infection, enhance containment measures, and also to work together to try and ensure that mankind all over the globe are actually focused with a movement of resources to deal with this issue. I think that they've also gone all out of the way to actually take the lessons from China and from various other countries. I also think specifically the Director General, Dr. Tedros Ghebreyesus, is actually someone who is a man of integrity. He's done his very best, and he can be criticized, but like anybody. But in this case, we think that attacking WHO and attacking the Director General is unfair. We think that the impact of this is really to distract the discussions, the focus. Instead of the whole world focusing on one common enemy, we're now beginning to turn against one another. I think it's not correct to do that. And I hope that Dr. Tedros will not be discouraged and that the WHO, because it's actually using a lot of experts, excuse me, a lot of experts who analyze and give us a lot of information and insight into what the best ways of dealing with this and other diseases. They've been like that all the time. And so I hope that with time, everyone will be able to see that they've done what they could do. In this case, the member states have to also take responsibility. We have to take responsibility about how we behave ourselves in this country, and every other country has got to do the same.
Thank you, Minister. There is a question from Sidwell Guduga. Many South Africans still believe that only people that the only people who should wear masks are healthcare providers, people who are ill, and those who are caring for the ill. Can you please emphasize the importance of wearing masks for all South Africans?
I think at this point, it's important for us to make the point very strongly that it's going to be very important now for all of us to wear masks, especially when we are out in the public, when we are out there, particularly amongst other people, because the infection can affect anybody. It can affect people who are not even aware that they're infected. In some instances, people can be asymptomatic but still infective, which means the risk is there for anyone to actually spread the infection. The level at which we are seeing the infection means now we can't really look at China, look at America, look at UK, look at Spain. We now have the virus. So we must also behave in a way that must actually help to reduce the spread. The studies that have been done recently have indicated that wearing masks actually reduce the level of the passing out of the virus, of shedding the virus in exhaled air, which means it's a lot more well established that if you wear a mask and you might be having an infection, it helps to protect other people, as it were. What we have then said is that the cloth masks are actually quite effective as well. What is important is that because there's been a shortage throughout the whole world of the specialized masks, such as the surgical mask N95 and so on, that we should retain those for the use by those who are health workers whose exposure is very direct. But most of us then can use cloth masks, and we are encouraging that now. And we believe that the cloth masks need to be encouraged and be worn by everyone, particularly as we walk out in the public space where we're amongst various people where the risk of spreading infection to others is very strong.
Thank you, Minister. We have Dr. Kemi Chetty as well, who's joined the Zoom briefing. And I'm going to request that she just gives clarity regarding the test kits. Some of the questions that have been asked in relation to this is, may I ask whether the GenExpert system cartridges have been validated yet? And if so, whether they are out in the field? This question has been asked by Charlotte from Prime Media. And another question from Nathan Giffen. It says, what's the status of the importation of GenExpert cartridges? Realistically, how many tests can we scale up to daily by the end of the current lockdown?
You've got the right person. Dr. Kemi Chetty is actually the CEO of the National Health Laboratory Services, and the issue of the various tests, the PCR, the antibody test, and the GenExpert, falls on her portfolio. So if you could be given the chance to respond to those questions, that would be very
helpful. Have been validated by the National Health Laboratory Services. We just got the kits during...
Excuse me, can we ask Dr. Chetty to just go back a bit? I think she was still muted when she started, so we got half the answer.
Thanks, Minister. The GenExpert kits have arrived during this last week. We have validated the kits and they are working. The GenExpert kits were approved by the FDA on the 20th of March, which was less than a month ago. And we are quite fortunate that we have managed to get the kits in within less than a month. We have received about 10,000 of those kits for use in the country. We are about one of the few countries who have received those kits. We've been working with the company to try to expedite the production. There's a production that has started in Sweden, and we're working with the company to try to increase the number of kits. We're hoping that we'll be able to receive as many kits as possible, but within 3 weeks of the approval of the kits, it's very difficult for the company to have the numbers that we want. We've asked them for about 10,000 kits per day. They've indicated to us that they will give us another 20,000 during the next week. We're hoping to ramp that up, because as soon as we ramp that up, it means we can use 183 sites to do as many tests as possible, but it's going to depend completely on the production of the company. So that's where we are with the Gene Expert kits. Over and above that, Minister, we are using a number of other machines as well. We are using a kit called the C-Gene kit, and we have quite a few of those kits in the country, over 200,000 of those kits. Over and above that, we also use the Cobus 6800 and 8800 machines, which is a Roche machine. We've been hoping that we could have got more of those kits, because it's a fully automated kit, but the production of that is limited by the supplier, and we are working with the suppliers to see how we can increase those number of kits. But thus far, the NHLS is able to meet the number of tests that have been given to us. We're hoping that that does ramp up, and we're gearing ourselves to improve on the number of tests that can be done. Thank you. I hope I've answered all the questions, Wu.
Yes, thank you, Dr. Chetty. May I ask that you just mute on your side so that I can unmute the minister?
Oh, okay. That basically covers the aspects. From where I sit, we're going to be increasing and scaling up, and it's going to be a combination of all these various technologies. Right now, the PCR tests which we're doing are going to be possible to increase. And then, of course, with Gene Experts, it's going to just scale it up even further. So we think that we will actually be able to reach a much higher level of testing. Thank you.
Thank you, Minister. We have a question from Catherine Child from Financial Mail. How many infected people on average are in hospital? Of the 3,000 cases, basically how many people need treatment, and what percentage get better at home in South Africa?
Well, the general figures go this way. From the total number of people who have the infection, about 80% tend to be mild cases. That means they are mild, mild or asymptomatic, so they don't need much attention. So in the process, you will end up with many of them being able to be treated at home, or not even needing treatment at all, even if you put them in a hospital. If you do, you will be doing so simply because you are wanting to just make sure that they are not infective in a company of other members of the family. But at the moment, we have got 241 people countrywide who are admitted. 162 of those are admitted in private hospitals. 79 are in the public hospitals. of those, we would say there are other 137 who are in isolation. They are not necessarily, they are not necessarily all in their homes. Some of them are actually in various other facilities. But those who are in ICU, there are 36. And then out of those, we've got about 23 who are on ventilators. So that's how it works. But every day the number changes because some of them will improve and then new ones will be admitted. But that's roughly where we are right now. Thank you.
Thank you, Minister. A question from Faisal Patel. Minister, there seems to be a very relaxed attitude in the community with regards to the lockdown regulations. How is this being maintained or, inverted commas, policed, as there was a concern about community infection, which was stressed by Professor Karim?
I think it's going to take a while before you can get everyone to understand the message of what stay at home is all about. Many people are trying to respond, and therefore, but they've not faced this situation before. Sometimes people take a long while to adjust to an environment where all they have is just a message, and they don't have their own personal experience about it. But I think it's going to be something that people will soon be understanding as the messages are getting more and more, and they also begin to know of people who are affected. And so this is going to actually mean a lot to people. But what we also notice, and this is what's been reported as well by various people, that sometimes it's not so much the question of people not caring as such. It's just a question of the way our the way our communities are structured. For people to have every day something to eat, they've got to go out and look for something somewhere. And many people have to go to town to go and find food. And then once we have a restriction in the numbers of taxis and with particular times that are restricted, then you find that anyone who misses the taxi stays over, and therefore you end up with people who are going to be, moving up and down throughout the day. Whereas in fact, it's really people who have been trying to get the bare essentials of life. And so those are some of the issues. In some instances, people just get bored, and we just need more and more conscientization so that people must understand that it's actually unsafe not to stay at home. My biggest concern when we sit and talk about this issue is the fact that you can have a lockdown. It will stop a lot of big meetings, big music festivals, and trains are not moving, taxis are not moving. So there's not a lot of movement of people from one city to another and so on, only to find that people are actually infecting each other in their own area where they are, simply because they're not focusing on the stay-at-home message. That message is very, very important. And when you begin to understand what it means, it basically means you might just get out and come back with an infection and infect your entire family. That message needs to be understood very strongly, that it is not safe to move out. And as we sit here now, we analyze various areas, we can see that the infection is still spreading. And that is because people are not staying at home. And that's the message that we need to always emphasize.
Thank you, Minister. A question from Takira from ENCA. Many of the people who have died have secondary illnesses of diabetes and hypertension. Has the department found that there is a link between these diseases and COVID-19 infections?
It's now an established observation that people who have got comorbidities or concomitant diseases tend to succumb quicker to the COVID-19 infection, mainly because their bodies are already strained by the need to deal with other diseases. In some instances, they are not even well controlled. And so when someone gets infected, it's their body that tends to fight the infection. It must develop enough antibodies to be able to eliminate the disease. And in so doing, the body needs to be able to focus on just one problem and not too many. And in this case, when you've got diabetes, the body is struggling because of the various, malfunctioning organs that it's trying to, work through, whether it's diabetes, whether it's blood pressure, whether it's kidney diseases. These tend to be the issues, or even cancers. They actually undermine the body's ability to repel an infection, and therefore they make the individual weaker. It's well established everywhere. That is why we raise the question that, we need to protect those people who have got comorbidities, even the elderly, because they tend to have various other chronic infections with them, or various chronic diseases with them, which are, based on the fact that with age, a lot more of these diseases tend to be part of the geriatric life. So this is a well-established association.
Thank you, Minister. I would like to direct this question to Dr. Kemi Chetty. If Minister can mute, just to allow her to unmute herself. Dr. Chetty?
Yes, Boo?
Yes. There's a question from Criselda Lewis from SABC. You've mentioned, Minister mentioned that over 100 tests have been conducted thus far. She would like to ask about the scale and the pace of the testing versus the number of mobile testing units available. Are all 60 mobile units operational?
Thank you, Sabu. Thus far, we have got about 52 of the mobile vehicles that have been deployed to the provinces. Some of the provinces have got their full quota of the mobile vehicles. During this week, we will get the rest of the other 8 vehicles to the provinces. With regard to the number of tests that have been conducted, the number of tests within the NHLS, both from the screening processes as well as the referrals from the hospitals, have been increasing exponentially. And the minister has given some of the stats. When we first started testing from the 9th of March, prior to that, the testing had been done by the NICD. And from the 9th of March, we decentralized to the NHLS laboratories. We started off with about 400 tests that were being done by the NHLS, and we've now increased to over 12,000 tests that have been done per week. So that we are seeing a daily increase. So between yesterday and today, for example, we had about 2,700 tests that were done yesterday. Today we have seen over 3,000 tests that have been done. So those tests are increasing with the community screening. And I need to point out that the screening has increased in the communities, but we go according to the case definition. So people who have got one or more symptoms are then referred to us for testing. So we don't determine the demand. The demand is determined by the number of people who fit the case definition. But we are seeing an increasing number with the number of screening tests that have been increased. Thanks, Sabu.
Thank you, Dr. Chetty. Minister, can you just clarify? Criselda just asked this question, whether the numbers of tests that are being released daily include retesting of positive cases to confirm if they have recovered or not?
Yes, I explained this at the beginning. The numbers of tests that we intend to announce are just the total number of people tested, which means we will then count them on the basis of this individual has been tested. Now, the numbers of tests that have been, the number of people who have been tested, I gave the figure is 108,000. But the number of tests that have been done as we speak now is 123,000. So the variance between the two are those people who would have been tested several times. I made an example of an instance where I was aware that one person had 3 tests done before they confirmed that the person had COVID-19. So some of the people will be tested when they get to be discharged or when they get to the end of 2 weeks. So you will find that those numbers don't get counted. We don't count the repeat tests. We only count once. It's not difficult to find that out because most of the people would have ID numbers and names and address and so on. So that gets checked. If you've got someone who's coming with the same name, same address, same ID number, you then know that it's a repeat test, so we don't count it. And we've got quite a strict system to actually count, to check all of that. We've got an IT team that's sitting at the back and is analyzing all of this to make sure that whatever number we announce, it has been checked. So the two numbers, we don't announce them both. We only announce the number of people tested, not the number of tests done.
Thank you, Minister. We'll just take 2 more questions, and then I'll request for Minister to then wrap up and close the session. There is a question from Laura Lopez Gonzalez from Biggie Sisa. South Africa is bringing in Cuban doctors to assist in the outbreak. Is that correct? What is the country doing to bring foreign trained doctors, both South Africans and foreign nationals, into the health workforce now? The other question, Minister, is from Smu Ngalwa, Newsroom Africa. During the press conference with experts, Prof. Abdul Karim indicated that the number of daily infections will determine whether the lockdown is lifted or extended. He said if the average is over 90 a day, then the lockdown will be extended. What is the daily rate of infection as of today, and what are you forecasting? And then, Minister, after responding to those questions, may I request that you close the session?
Thank you very much for those questions. Yes, we have requested assistance from some of the countries to come and reinforce. In our case, we've asked for assistance from China. We've asked for assistance from Cuba. Those are the main ones which we have actually requested. And this is also based on the fact that they have offered assistance to various other countries. What China has done already is to deploy experts who will converse with us and take us through discussions on the questions that we asked and so on. We've already had a very successful conversation or video conference with them. And so we're waiting to see what other assistance they will be able to assist us with. But where they've also, China has also assisted, was to open up where the supplies were constrained and we couldn't, the whole world was trying to get supplies from China. They've made it possible for China, for South Africa to get as much of the orders that we've asked for. So we've really been very grateful to the support from China. India has also given us support in the sense that when they closed down to say there are certain medication that won't be leaving India, but when we approached India, they actually created a special arrangement for South Africa to be given that support. So again, we've got that kind of support from India. From Cuba, there's been a standing arrangement where Cuban doctors would be asked to come and reinforce whenever we needed that. I'm sure everyone knows that we've got a number of Cuban doctors in South Africa, apart from the students who have been to Cuba and be trained in Cuba. And so at the moment, we're expecting a group of close to 180 Cuban doctors and various other specialists who might be coming to join us in the next couple of weeks. And so this is the kind of support that we will be getting from Cuba. When they come here, we'll be deploying them into various areas. The strength of Cuba, other than the other specialists, is their very strong community health approach, wherein doctors are able to create a sense of a presence around a community and help us to go house to house to create health records per family, so that you can actually know what's happening in every family as you move along. And this for us is the future, where we'll be taking our health services to, where for every person there has to be a point, there has to be a professional service which accounts for the individual. If you go to the UK and other countries in the West, there are general practitioners who account for each and every individual. In our case, the shortages are such that that is not possible. So we believe that Cuba is going to be very helpful, particularly here, because we're dealing here with a preventative approach where we need, a lot of involvement of community and understanding the profile of the diseases in any community to be able to prepare for preventative measures and how to deal with health promotion and ensure that for every community that we are screening and visiting, we can always be able to do a surveillance mechanism to pick up the infection or the outbreak long before it becomes a problem in the community. So we're looking forward to the support from Cuba on that basis. I raised this issue earlier. The discussion that was raised by Professor Abdul Karim was an approach as to what he felt was the way the Ministerial Advisory Committee were looking at the issue. And of course, you get the approach based on the analysis that they do, and as more and more information comes, they then vary their advice depending on what information that they were getting. I did explain earlier that their analysis up to now was that the figures that we were seeing of the past few days, where I think in some instances we would have about 95, and in some instances we had 4 or 5 days ago we had even lower, about 20, 25 or so, that some of the daily variations, they actually look at the trend over the week and see whether it's veering too far out of the averages that they put up. So in this case, they actually made an analysis that the figures that we're seeing were not very far out of their statistical average that they put in terms of the range of 45 to 89. And they were then saying that from 45, it's a range which is based on the percentage of certainty that they've got about that whole range. And it actually can move from 50 to another figure, maybe say, or just over 100, as it were. And that is a range that is acceptable within their statistical model. And therefore, they actually felt that at the moment, the expectation for a huge increase has not yet materialized up to this week, based on the fact that the numbers of people that we are seeing are not quite the same as those who were coming to our services earlier. So in other words, at the beginning, we're dealing with people who were self-referrals, who would come from home because they've got symptoms. Now, when you analyze, you have to always make a distinction between the kind of cohort you're dealing with. If you're earlier dealing with people who are coming to self-referrals, it's different when you actually go out and seek people from the community, because that obviously is supposed to push up your numbers in a particular way. Now, in so doing, you need to then be able to consider that you have increased your search for people out in the community who would not have otherwise made themselves available to the health services. And then you also expect that there should be a variance based on the fact that there should be some degree of internal transmission that is taking place. But when they looked at the whole issue, they felt that it had not distorted the trend of the curve. And so they were going to be observing how this is going to be happening, what's going to be happening going forward. We have not got to a point where a decision has been taken based on those numbers, but we are very keen that, in the next few days, some more assessment and evaluation has to be looked at so that we can get a much more consolidated view from them. And so they're working on that. We still got another week to look at. So this week's figures will give us a guide, but that's not when a decision, is being taken. So that decision will have to be taken by the National Command Council, but we're expecting at the moment that our consultations with them must continue to give us further guidance in terms of what other suggestions need to be looked at this point. So I think in the next few days, we'll also get if there's any new ideas that they've got, and then out of that, the Command Council will be given an advice, and then the decision will be taken. Having said so, I want to just say that we've almost heard about, I think, just almost 20 individuals asking questions. It's been quite a while, but I think it's been very important for us to try and clarify certain issues, because it helps as you write, as you report, to be able to have a perspective based on trying to clarify issues. I must say that I've been looking at how this issue is being reported. I really have to commend the media for the determination to make sure that the stories are recorded, but also to try and keep to the factual side of the issues. It can be very tempting to run away with all sorts of fake news and sensitivities and sensational news and so on. But I've not really seen a lot of that, and I really want to commend the media, because what's important to us is that we cannot have a wrong message sent to our people, because it will actually affect their behavior negatively. In this case, we need everybody on board. We need each and every person to know that individual behavior might be all we need to save the nation. And individual behavior may be all that we need to actually disrupt the whole life of the entire nation. Whenever we talk about this, a very instructive case of patient number 31 in South Korea, it was one person who actually unknowingly ended up with a whole outbreak being referable to one incident of a church meeting. And I think we need to always know that this outbreak is very sensitive. Our own conduct will determine whether we succeed in combating its spread or not. And the virus is the same all over the world. It affects the rich, it affects the poor, it affects the black, it affects the white, it affects any nationality. It doesn't care about social status. Because of that, it is only the conduct of the community. That society needs to decide on its own what they want to do to face this virus. And in this case, so far, South Africans have actually tried their best, but all we're asking for is that let's have more unity amongst all South Africans. Let's have more focus on factually what is it that needs to be done. And we are also using science to actually base all our actions. And at the end of the day, we'd like to keep it as transparent and as open and as a conversation of South Africans who are trying to look for a solution. And each and every one of us has got a role to play. It's very, very important that we need to support the leadership provided by government, provided by the president, provided by the various health experts and other experts who are part of this whole effort. And if we can do that, we might just prove to the world that, in fact, as much as this is a very virulent infection, but a change in conduct and learning from others might actually change the the cause of the outbreak, and there might be lessons to teach other people as well as what can be done. But if we're going to ignore all the the science behind it, if you're going to ignore the facts about it, ignore the guidance in terms of what needs to be done, and also stop caring about each other, we are going to find ourselves into a problem. I think COVID-19 as an outbreak will find South Africa, South Africa will be very different after the COVID-19. I think we'll have probably learned that we depend on each other more than we actually are aware of. That uniting behind the whole program is a lot more important to take the country forward, and that at the end of the day, we actually do belong together. And whatever happens to one of us will happen to all of us. And therefore, working together is going to help us to make sure that we can defeat the COVID-19. Let's work together. We are concerned that the numbers might be slowly increasing. We're seeing the numbers of people whose lives we're losing. All of these are indicators to us that if we can change our behavior, we can actually make a dent in this infection. Thank you very much, and thank you for your time. Good night.
Thank you, Minister. Maybe just as a closing remark, we did receive messages asking us to tilt to the minister's screen because they were seeing your nose more than your eyes, Minister. We apologize profusely for that, and we can only improve from here. So next time, we will make sure that we give you a better angle. Thank you. Good night.